CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello and welcome back to our new season of CYC MD. Previously, if you recall, we met with different healthcare providers, all of whom provided us with insights into their career as well as schooling and education. In this new and exciting season, we are indulging and digging deeper with our professionals in regards to their focused area of expertise. Heart attack is one of the leading causes of death in America. Today, talking on the topic of heart attack is our cardiologist, Dr. Amgad Makarious. Welcome again. Who is the chief cardiologist of Nassau University Medical Center. So, heart attack, it's always one of those topics that once you talk about it, people get a little nervous. Statistically, men and women, who experiences heart attack more, just statistics, and also which range or target age group should be more worried about experiencing a heart attack?
So there's a lot of confusion about the discrepancies between men and women when it comes to heart attacks. The one thing we do know is that heart attack is the most common cause of death. Heart attack and heart disease, cardiovascular disease, is the most common cause of death for both men and women. Okay, so keeping that in mind, the confusion came into play because women tend to have certain different factors that might cause them to present later with heart disease as opposed to men. And this has to do with a lot of the hormonal differences between men and women. However, that also led traditionally in our medical community to under-recognition of signs and symptoms relating to heart disease in women compared to men. This leads into a good discussion of the signs and symptoms, but when we talk about the classic heart attack, a lot of people are familiar with that tightness in the chest, that elephant sitting on your chest causing chest tightness, and that's the classic heart attack. While women have been found, compared to men, to have less of these classic symptoms of chest tightness, and thereby might be under-recognized or thought to have other causes of their symptoms. So women might tend to have shortness of breath. They might tend to have back pain. They might tend to have dizziness or palpitations. And those are the signs that they might have as opposed to that classic symptom of tightness in the chest or that big elephant sitting on your chest, the classic chest pain. So that's what we talk about. Of course, the risk factors that come into play, all the bad things like hypertension, diabetes, obesity, all of these tend to play into the effects of causing a heart attack and play into the effect of what ages will tend to develop heart attacks. So as we go greater in age, 30s, 40s, 50s, people tend to develop high blood pressure, diabetes, if they're not taking care of themselves, if they're not eating a healthy diet, if they're not watching their cholesterol intake, if they're not exercising. All of these things play into it. If they develop diabetes, diabetes is known to be a major risk factor in terms of predisposition for heart attacks, whether in men or women. So again, the important thing to keep in mind is common cause of death in both men and women. So therefore, the more we can do to decrease the risk factors relating to it, the more we can prevent unnecessary deaths related to cardiovascular disease.
So what is a heart attack?
So a heart attack, very simply, and again, my motto of a picture is worth 1,000 words, is really a blockage that takes place in the heart itself. And when you have the blood supply compromised, it all has to do with the plaque that develops in the artery. So we talked before about, in terms of in the other episode of hypertension, and how when that hypertension is there, you actually get different damage to the blood vessels, where you have these areas where plaque can build up. That plaque is an inflammatory area, and the body, whenever it sees inflammatory particles, it'll send different platelets to that area in order to try to prevent or try to heal it. When you get a lot of platelets that now plug up and hook up in an area with a lot of plaque, which we actually see in this picture here, this shows you a normal artery. The arrow is depicting the normal blood flow within the artery. This is showing an artery that has a tremendous amount of plaque. And what you can see is the blood flow is now impeded. When the body sees this type of inflammatory process taking place, inflammation being, all the active blood cells and everything else taking place there, it'll send platelets to that area to try to heal it over. As it sends a lot of platelets, and if this plaque were to rupture, it will completely close off the artery and thereby stop the blood flow completely. When you close off the blood flow to a particular area, especially if it's in the heart, that part that's supplied by that blood vessel will start to die, because now it's not getting oxygen. We know that the blood carries the oxygen. When that happens, you suffer a heart attack. Depending on which artery you block, in which location you block that artery, it can be a major heart attack, and some people will just die suddenly with the heart attack, and they won't even make it to the hospital. Other people, depending on where the blockage is, might start feeling the symptoms of chest pain. So that's why it's very important when you start to have any of these warning signs to call 911, or if you're having these symptoms over time, if you see a physician regularly, make sure you tell your physician about these signs and symptoms in order to prevent this outcome from happening.
So you did mention as a sign and symptom, you said chest pain or the elephant sitting on your chest. What are other indications that can be also alerted for a patient other than chest discomfort?
Right. So along with the chest pain, since there aren't, classic nerves that we know about, we know there's nerves in our skin and we can feel and touch and everything else, the nerve supply to the heart tends to be a little bit different. And so therefore you can get referred pain. As opposed to chest pain, you might have jaw pain. You might have left arm pain. You might have shortness of breath. You might have diaphoresis, and what that means is sweaty. You can have a sweatiness that you'll feel. And all this is related to the body trying to compensate now for a part of the heart, which is blocked off and not getting the oxygenation that it needs. You can have palpitations. We talked about arrhythmias in one of our other episodes. You can have a pretty bad arrhythmia secondary to a heart attack and a blockage in one of the arteries. So all these are signs and symptoms. And again, it's important to recognize the differences between men and women, because women tend to have slightly more what we call atypical. They might have more of the shortness of breath. They might even have back pain. They might have dizziness. They might just feel tired. A classic symptom of somebody with ischemia is fatigue. If you're having ischemia, meaning the blood supply to your heart is not normal, you might actually have that problem.
So as far as we did mention, we talked about heart attack. Along with that, people confuse it with a stroke. What is a stroke?
So a stroke is very similar to a heart attack. It's actually what you might call a brain attack. It's the similar type of idea where that blood vessel has plaque in it, and it therefore then gets closed off to cause a lack of blood supply to a particular part of the brain. Now, the symptoms here will be very different, because now you're affecting a different organ. As opposed to the heart, where you might get chest pain, in the brain you might actually pass out. You might get weakness in a part of your body, because now you're affecting the nerves that actually are parts of different parts of your body. So all these things taken together can actually cause different issues when it comes to different things in the actual brain, and you'll have all different kinds of symptoms. You can feel a headache. You can have vision changes. All these are types of things that you might experience.
So I know one thing that they tell us is that if you are experiencing a heart attack, to chew 2 aspirins, baby aspirins. What's your take on that?
So aspirin will definitely help because aspirin works on these platelets that we talked about when it comes to plaques. The one thing I would say is, even before you start to treat yourself, if you feel like you are having a heart attack, the best thing you can do for yourself is call 911 because that will mobilize the medical field and get you to where you need to be, which is really in the hospital. If you're having a heart attack, you need to be in the hospital because there are treatments that we can actually give to help prevent the heart attack from getting worse. If you do have access to aspirin, you can take an aspirin, and that will also help. A baby aspirin can help with the situation as well because it works on the platelets. So when you come into the hospital and we're worried you're having a heart attack, we will give you an aspirin when you're in the emergency room. But the important thing to keep in mind is you need to get access to medical care as soon as possible because that will help with all the other interventions that we can do to prevent the heart attack from really causing a major problem.
Mm. So what are benefits of taking a baby aspirin?
So the benefits in people who are at risk for heart disease, they again work on the platelets. And aspirin is an antiplatelet medication. And that's why if you take too much aspirin, you can actually bleed because the platelets are what prevent you from, or help clotting, help the blood stop bleeding. So what they do in the body in people who are at risk for heart disease is because you have these plaques all over the place, the platelets see these plaques and they try to plug them up, if you will. And by trying to plug them up, there's an actual bad part of that where they can actually seal off the vessel and cause a problem. And if they do that, then that's the type of thing where you can actually close off the vessel completely and cause a heart attack or a stroke or those types of events related to the atherosclerosis. So taking the aspirin, we could talk about primary prevention and secondary prevention. So people who've had heart attacks, if you were to take aspirin, that's secondary prevention because you've already had a heart attack and what you're trying to do is to prevent another heart attack from happening. Okay. Primary prevention is people who are at risk for heart attacks but haven't actually had a heart attack yet. And in those people, we give them the aspirin to prevent a possible future heart attack from happening. So those are the recommendations that we talk about when we talk about prevention, whether it's primary or secondary.
Okay. So when taking aspirin, are there any risks you would say, or people that maybe that should be more cautious taking aspirin?
Absolutely. Like any medication, we know that there are side effects to a medication, and the classic side effects to aspirin would be bleeding. Mm-hmm. So, for example, if somebody has very bad ulcers in their stomach, which are predisposed to bleeding, if you were to take a lot of aspirin without taking it, without being careful, you can actually have bleeding in your stomach, in your GI tract, and really cause a problem. So the major side effect is really the bleeding side effect. Some of the minor side effects that can happen is people who get black and blue marks. They'll bruise themselves because, again, the blood is thinner and the blood supply won't clot as easily as it was because it's actually thinned. We talk about blood thinners. Mm-hmm. Okay, aspirin is an antiplatelet medication, but there are other medications that we can give that are blood thinners that might actually cause you to bruise more easily and have problems with bleeding. So that's really the major side effect when it comes to aspirin. Of course, another major side effect is some people rarely will have allergy to aspirin. And if you were to take an aspirin, you can have an allergic reaction. But those are less common.
So, I mean, we know heart attack, we mentioned, is caused by stress, anxiety, or anything that can cause such stress to you. What are ways that I can decrease stress and anxiety?
So stress and anxiety, we know, predisposes us to worsening levels of the abnormal hormones that we talked about that can lead to high blood pressure, diabetes, all the other bad things that can happen, heart attacks. So decreasing stress is really depends on, if you think about it, your outlook on life. And we know that people, for example, who have mental disorders, depression, other disorders tend to have higher levels of these stress hormones, and it has to do, again, with a person's outlook. So the way you look at it is, a lot of the things you can do to decrease the level of stress in your life is very important. So we talk about exercise. So regular physical activity is very good for decreasing stress because what it does is it allows the body almost an out when it comes to a lot of these stress hormones. And when you were to exercise, it helps with that type of relaxing your body after, of course, you finish the exercise. We talk about yoga exercises. Yoga exercises or other relaxation techniques can help decrease the amount of stress. Just taking a deep breath will help you relax in certain conditions. We've also found that people who have more social circles, more friends, tend to have longer lives. They tend to live longer. They tend to have less stress. Family support networks, help you with decreasing stress, and also your outlook on life. We talk about the people who look at the glass half full versus the people who look at the glass half empty.
Right.
So the people who tend to have a more positive outlook on life, and we can really affect the way we look at life and our positive outlook, and our hopes and our desires and our dreams. Faith in God is an important thing that can help decrease your stress and help you worry less. So all these things can help with stress in your life.
We're going to stop for a short break.
Okay.
And we'll be right back. So stay tuned for more. So many times people who experience a heart attack would end up having a stent. What is a stent, first of all, and how exactly does that work?
Yeah, so a stent, you can think of it as, something that will open up the artery. We talked about the plaque and how the artery closes off, and thereby the blood doesn't get past that blockage. So the stent is really a little piece of mesh. It's like a wire mesh that actually goes into the artery, and you expand it with a balloon and just break the plaque into the wall of the artery, and thereby allow the blood to then go through the artery itself again. And we do this, it's really a mechanical way of opening up an artery. You think of a clogged plumbing pipe. It's the same type of thing. You go in there, you put a stent, it breaks the plaque open, and you can actually then re-establish the blood supply to that area.
And just to conclude, what are some preventative measures? I know we talked about, taking as a prophylaxis, we said taking a baby aspirin, and I know we keep repeating this, but what are some preventative measures that we can do to prevent ourselves from getting a heart attack? And we did talk about stress, but other than that.
So besides the stress, which is bad, a lot of our viewers are now experts in a lot of the good things that we can do. And they're really similar types of things to high blood pressure, for diabetes. And a lot of it, again, relates to what we eat. So eating a heart-healthy diet, which we talked about. Exercising, maintaining physical activity, at least a half an hour, hopefully every day. If you can't, at least 3 to 4 times a week. Also maintaining a healthy weight. So part of the exercise and watching your diet will help you maintain your weight. And of course, we have medications that can help with people who have high cholesterol, with people who have high blood pressure, and the aspirin is another way of helping prevent heart attacks, and also with people who have heart attacks and helping prevent future heart attacks.
Right.
So all these things taken in combination will help make you a healthier and happier person.
Thank you so much. Thank you so much. Appreciate all, the information that you gave us. And I mean, I know your schedule's a little tight, but God bless you for all the efforts, for you taking time out to be with us on CYC.
Thank you. It's my pleasure.
A healthy heart calls for a healthy body, calls for a healthy mind. I hope you enjoyed our episode on CYC MD. Until next time, have a blessed day.